Hi, my name is Lynelle Paro with the Bureau of Immunizations with the Missouri Department of Health and Senior Services. Today we're going to talk about immunization requirements for children enrolled in child care and preschool. All students must present documentation of an up-to-date immunization record, including the month, the day, and the year of each immunization prior to enrolling in and attending child care or preschool. The Advisory Committee on Immunization Practices, what we will refer to as ACIP, allows a 4-day grace period. Students may get an immunization 4 days before it is technically due and it still be counted as a valid dose. However, 5 days, 7 days, 10 days prior is not a valid dose. Missouri required immunization should be administered according to the ACIP schedule, which includes all spacing. In order for a child to remain in school, there are a few exemptions that we'll discuss. The first one being an immunization in progress. Immunization in progress means that a child is in the middle of a series, has begun that vaccination series, and has an appointment scheduled for the next vaccination to occur. That does not mean they can't get in today, so they have an in progress card as an appointment for their next given dose. It must mean that they are in the middle of a series, and that must be signed by an MDDO or his or her designee or one of the local public health agencies. This is an example of an immunization in progress card where they would put in the child's name, the doses that they received, and the date that they're scheduled to return. Also, we'll talk about a parent-guardian immunization exemption and a medical exemption. Immunization exemptions have to be the original exemption, a Missouri exemption, and that excludes a child from child care or preschool in the event of a vaccine preventable outbreak. A parent-guardian exemption can be for any vaccine, all vaccines. They can pick and choose on the card which vaccines, and this card must be renewed annually. Therefore, if it gets placed on file today, then in July 5th of 2025, you would require the child to have a new card placed on file. This is an example of a parent-guardian immunization exemption where the parent will check that they have read and are informed of the consequences of not immunizing their child, such as they can be excluded during that vaccine preventable outbreak. This card just has to be signed by the parent, and the original card or the original form must be placed on file with the child care facility, and it, again, must be renewed annually. A medical exemption, again, can be for all vaccines, selected vaccines, and this card must be signed by an MD or a DO or his or her designee, indicating that the vaccine can harm the child. The medical exemption can also be used for documentation of varicella disease if the physician is checking the box on the card that states that the child has documented disease or laboratory evidence of the immunity to the disease. This is the example of the medical immunization exemption card. Again, it must be signed by an MD, DO, his or her designee, cannot be signed by a DC, which is your doctor of chiropractic medicine. It must be an MD or a DO or his or her designee. The exemptions, you can have the original form or what we call the original card can be obtained by Department of Health and Senior Services or a local public health agency. And that does not have to be the original card any longer. We will accept a printed copy from our website. However, it must be the actual card. So to obtain an immunization exemption for child care, if you access our website at health.mo.gov/immunizations, you're going to click on child care for a child care facility. If it's a school facility, it would be school for children enrolled in grades K through 12. Once you're on the child care page, you would scroll down to where it says the Missouri Child Care Preschool Reporting Information. Underneath there where you see Code of State Regulations, there's the link for the medical immunization exemption and a parent guardian exemption. This is an example of a fact sheet that we have once the parent clicks on the link. The fact sheet just discusses the importance of immunizations, also reiterating that the child can be and will be excluded during a vaccine preventable outbreak of the facility, which would cause the parent to have to get alternate child care during that time. Those are available again on our website. It must be a Missouri exemption. It cannot be an exemption from another state, and it cannot be a written statement from the parent. It has to be on the actual form or the cardstock card. Again, your medical exemption must be signed by an MD or a DO or his or her designee, and the in progress card must be signed by a physician, public health nurse, or his or her designee. Now we're going to talk about the requirements that are required for children in the birth to kindergarten entry, meaning they have not entered kindergarten. So as you'll notice on the schedule, we have birth all the way through 18 months with the various doses required, and then 19 months to kindergarten entry. When you're looking at the requirements, you'll notice that birth to 2, they don't change. And then from 3 to 4 months, they don't change. Then 5, 6 months are the same. And then 7 through 18 months are the same. And then we have the 19 months to kindergarten entry, where once a child turns 19 months of age, they would be compliant until they enter kindergarten. This is a screening tool that we developed to help providers to screen immunization records. This is a basic screening tool. It's not meant to catch every case scenario that you may run in, but if your child's records that you're screening follow this and they show that they're in compliance, then they would be compliant for childcare or preschool. And we're going to walk through each vaccine category for this. So first, when you're using the screening tool, of course, you're going to determine the child's age to know what age they are, to know what requirements. So then you determine the child's age, you review the immunization requirements for the child's age, and you're going to count the number of doses required for each vaccine category. When you get to the children that fall in that 19 months to kindergarten entry age group, that is where you really need to pay attention to the spacing for each of those vaccines. Also, you need to ensure that you've checked for a parent guardian immunization exemption, and if that exemption is on file, is it current, because again, they must be renewed each year. Of course, if you have an in progress card on file, you're going to look to make sure that that child is truly in progress and the date of when they should return has not passed. So looking at DTaP, we're going to again determine the child's age. And if we have a child who falls in the 5-month or 5 to 6 months, they're required to have 2 doses. Then when you get to the 19 months and older, you'll notice again, that's where you need to really pay attention to the spacing requirements. So for a child that is 19 months or older, they would need to have 4 doses, and there has to be at least 6 months between dose 3 and dose 4. For polio, you notice you have a dose at 3 months, and again, 3 to 4 months. Then you have 5 months, which is 2. That would apply to a 6-month-old. And then you have your 7 months, which would be 2. And a child that falls 7 months to 18 months would be required to have 2 doses. And then your 19 months and older are required 3. And for polio, at that 19 months to kindergarten entry, there is not a spacing requirement. Now we're going to talk about Hib. With Hib, it's always going to depend on when the child started the series to determine how many doses they receive. If they receive the allotted amount or the required amount of 3, then you need to ensure that they have 3 doses with the final dose on or after 12 months of age. However, if a child starts the Hib series later, they potentially could only have 2 doses. So if they have 2 doses, you just want to ensure that the 2 doses with 1 dose on or after 12 months of age. And again, if they're late in the series and they only have 1 dose when they're in that 19 months to kindergarten entry, you're just going to make sure that they have 1 dose that's on or after 12 months of age. If the child is in child care or preschool and is in that age group of 5, and they only have 1 dose, 2 dose, or 3 doses required, they are not going to need any additional doses as they have aged out of that vaccine. So once they reach that 5 years of age and older, they're no longer eligible to receive Hib. Hepatitis B, 3 doses are required for that 19 months and older. You can see the doses for your 3 months, your 5 months, and your 7 months, again with no spacing requirements. But when they reach that 19 months and older, they have to have their last dose on or after 24 weeks of age. And the spacing must be met for those 3 doses. So with the dosing on hepatitis B for that 19 months and older group, they have to have the 3 doses with 4 weeks between 1 and 2, 8 weeks between dose 2 and 3, 16 weeks between dose 1 and 3, and again, they must be at least 24 weeks of age or 6 months of age. Pneumococcal conjugate, or what we call PCV. Again, this vaccine is going to depend on the doses they receive, is going to depend on when they started the series. If they fall in that 19 months to kindergarten entry age group, you're going to look to see how many doses they have. If they have 4 doses, you're going to ensure the 4th dose was on or after 12 months of age. If they only have 3 doses, you're going to ensure that they have 3 doses with 1 dose on or after 12 months of age. If they have 2 doses, then you're going to ensure that they have 2 doses both being on or after 12 months of age, and then 1 dose with 1 dose being on or after 24 months of age. And again, once that child reaches the age of 5, they are no longer eligible for that vaccine. Therefore, there would be no additional doses required, or if they did not have any doses, they would not be required to have a dose of pneumococcal based on the fact that they are aged out of that vaccine. MMR, measles, mumps, rubella. In the United States, we only have MMR vaccine. We don't have single antigen, so a child should be receiving MMR. That dose is only required for those 19 months and older, and it must be given on or after 12 months of age. And if MMR and varicella are not administered on the same day, then they must be at least 28 days apart. And the reasoning for this is because MMR and varicella are both what we call a live vaccine, and they have to be given on the same day or separated by at least 28 days apart. And again, they must be given on or after 12 months of age. For varicella, again, it has to be given on or after 12 months of age. It's that 19 months and older are the only ones that are required to have that vaccine. If varicella is not given on the same day as MMR, then it has to be separated by at least 28 days. And for proof of varicella, meaning the child has had chickenpox, they must have a written statement from a licensed healthcare provider showing the month and the year of varicella disease, or they could have a medical exemption on file. Now we're going to move more into some of the other requirements for the child care, daycare, preschool, which is no child can attend a public, private, or parochial daycare, preschool, or nursery school caring for 10 or more children unless they have been adequately immunized. If you're licensed for 10, you must ensure that you are screening those children, and they cannot enroll if they're not up to date the day that they enroll. If you have a child who is attending elementary school who is at your facility for only before and after school care, they must meet the requirements for the school immunization requirements that you'll find in 19 CSR 2028.010. They do not follow the child care preschool immunization requirements. So to talk about satisfactory evidence of immunizations, that must be a statement, certificate, or a record from a physician. You can use something printed from the Missouri Immunization Registry, which would be Show Me Vax, printout from the physician, a copy of a parent's blue card that the physician may record the vaccinations on. And again, that must show the vaccine that was given or the antigen, as well as the month, the day, and the year that the vaccine was administered. Now we're going to talk about the summary report of immunization status that's due every year by January 15th. This report is required for any facility that is caring for 10 or more children. If you're licensed for 10 and you only have 9 children enrolled at the time, then you must still report. However, you're only going to indicate that you have less than 10 children. And this is required every year, January 15th. The date does not change. You can do the summary report by mail. You can do it by fax. You can also do it online. This is an example of the summary report for the immunization status to be recorded, and you'll notice that we're recording the 0 to 2 months, then we do the 3 to 4, 6 through 8, 7 through 18, and then 19 months to kindergarten entry. You're only going to report the immunization status by those age groups. Here is the box where you'll notice that it says if less than 10 preschool age children birth to school entry are enrolled, check the box and return the report by January 15th. Again, if you're licensed for 10 or more and you only have 9 enrolled, then you would just check this box and return the report. Even though you have less than 10 children, you are still required to return the report. When we're looking at this report, again, you're reporting by age group, not a total towards the end. It's just by age group. You're not reporting your children that are 19 months are not going to be recorded in the 3 through 4 months because you have records of them for 3 to 4 months. You're only reporting of the child's age that they are at that time. 2 areas that I want to draw your attention to is the children in non-compliance with immunization record and the children in non-compliance without immunization record. If you have a child who is non-compliant for that vaccine category, but they're compliant in everything else, or you have a record on file, then you're going to indicate them as being non-compliant with immunization record. If you're reporting a child who does not have an immunization record on file at all with your facility, then you're going to report that as a children in non-compliance without immunization record. And that number will be consistent through each vaccine category because that indicates that you have no record on file for that child. Now, when we get to MMR and varicella, you will notice that there is no children in progress category. Because of the fact that there's only 1 dose required for this age group, they cannot be in progress. They either have the vaccine or they don't have the vaccine. So you don't have the option to put children in progress, because that child in that 19 months to kindergarten entry would be considered non-compliant because they are not vaccinated. When a child reaches 19 months, they must have those required vaccines. It doesn't mean that they have until kindergarten entry to get those vaccines. With MMR, you'll notice the note in progress as well as varicella. However, with varicella, you will see a spot for a child with proof of disease. If you have a child who has had chickenpox and you have that written statement or that medical exemption showing they have proof of disease, then you would indicate them in a child or children with proof of disease. If you have parents asking possibly where their children can get immunized, of course, you have a healthcare provider, their primary care physician. Local public health agencies do vaccinations. Our federally qualified health centers, or what we call FQHCs, rural health centers, or RHCs, and any child under the age of 18 or through their 19th birthday until they turn 19 are eligible if they do not have insurance or they are uninsured, underinsured, for the Vaccines for Children program. If you need additional information on the Vaccines for Children program, you can reach out to our office at the 1-800-219-3224. This is an informational sheet that you can share with your parents about the Vaccines for Children program. Again, if a child has no insurance, they are underinsured, Medicaid, or an American Indian, Alaskan Native, they are eligible to receive free vaccine from a Vaccines for Children program at no cost. However, that provider could ask that they pay what's called an administration fee for that vaccine. However, if they are unable to pay and they communicate that with the provider, they cannot be turned away from the program. Now we want to talk about Show Me Vax. Show Me Vax is a great tool that child care providers can have access to, which allows you to check the immunization status of a child. You can log in. You have the ability to get read-only access to check immunization records. If you have a parent who is having trouble getting one from their physician or needs to get an updated one, you can always look in Show Me Vax to see if that record is on file and print that for the parent or print it for your records. You must have what's called a memorandum of agreement on file to have access to Show Me Vax, but once that is completed, you can request read-only user access. If you don't have Show Me Vax access currently, then you can reach out to our Show Me Vax help desk at the 866-256-3166 or by emailing vfcsmvsupport@health.mo.gov.